Hi folks, it's Dr. Sloan. We're going to go through the autonomic nervous system. Hopefully this is a review for you. I know this is a complicated system to learn, but I think once you can get in your head the difference between parasympathetic and sympathetic, that will really help you in terms of thinking through what these medications do. Okay, so let's just review. We have a nervous system, right? And we have the CNS, the central nervous system, brain and spinal cord. And then we have the PNS, which is the peripheral nervous system. And then you have motor neurons and sensory neurons here. And a somatic nervous system, which controls voluntary movements like I'm going to reach out and pick up this cup, right? Then we have the autonomic nervous system, which controls involuntary responses. And that is divided further into two more systems, the sympathetic nervous system and the parasympathetic nervous system. So these boxes that are in red are the only ones that you're really going to have to pay attention to. And specifically, we're just going to be looking at the difference between sympathetic and parasympathetic. So hopefully that helps, but I wanted to give you kind of the framework into which all of this fits. Okay, so I gave you a little hint before when I was reading it, but do you have control over your autonomic nervous system? And, you know, there are those who would say that with meditation or relaxation or exercise, you have some control. You can control your breathing and other things. But in general, the answer is no, we don't have control over our autonomic nervous system. It's making all kinds of adjustments and taking care of all kinds of body functions 24/7 without us having to think about it or to will it to be done. Things like your heart rate and your blood pressure regulation, that's all being done in the scenes behind. Okay, see this little guy? He is the scary monster that you are running from. Sympathetic nervous system is fight or flight, right? This is something that kicks into gear when we are stressed, actually. You probably were feeling a little bit of this when you took your last quiz or test, where you feel a little nervous, maybe your hands are sweaty, you're not thinking real clearly, and you can kind of feel your heart rate going. So this is what happens. And if you think about it, it makes sense. You know, if you think about the fact that we are built to, for self-preservation, to keep ourselves alive, it makes sense that we have a system that gets activated when we are being threatened in some way. And so if you think about that, that'll help you in terms of, just remember fight or flight. So your pupils, they tend to dilate, meaning they get really big. Usually when your pupils are dilated, like if you've ever done it like in a movie theater, it helps you to see in the dark. So that really makes sense, right? Your lungs, your bronchioles, the little tiny tubes that deliver oxygen to your alveoli are going to dilate and get big because we want to make sure that we can get enough oxygen in to keep our heart and muscles working and pumping because, again, we're running from a scary monster. Our heart rate is going to be increased, right? Our blood vessels are going to constrict to increase our blood pressure. That blood pressure is also increased as a result of the heart rate, but all of those things are happening so that blood can be returned to the heart and we can, again, keep running or fleeing or fighting. Gastrointestinal, you tend to have smooth muscle relaxation in there, so it's possible that you could, like, if if anybody in here has ever had this, you get really nervous about something. You can actually have like diarrhea. Bladder, your bladder muscle, and bladder muscle is kind of an oversimplification because you have a muscle that squeezes your bladder, but you also have a muscle that relaxes to let the urine out. Anyway, that's it for another day. But it allows basically for you to, to urinate. And sometimes that happens when we're really scared, right? And then uterus, it can relax the uterine muscle. And I only bring that up because it's important in the area of labor and delivery. So if you think about it, fight or flight, probably giving birth is kind of a fight or flight situation, at least in terms of our perception of it. Having done it twice, I would say it was not fun and very painful, but I did want my uterus to be relaxed. And anyway, ended up being the two very best days of my life. Okay. So parasympathetic is the opposite. It's rest and digest. It's the couch potato, right? He's got his remote, he's watching a game, he's been eating a pizza, having a little something to drink, just kind of chilling out, right? So this is when we are not in fight or flight mode. This is the opposite of that. So our pupils constrict. They don't need to be dilated. They can be back at normal. Our lungs. So bronchioles are constricted, and you have increased secretions. And normally, what's happening there is between the sympathetic and the parasympathetic, we're regulating lung function. But this is important to know because some of the drugs we give that are parasympathetic, cholinergic drugs, can actually cause some problems with lungs. So we need to be aware of that. Your heart, you have a decreased heart rate. Your blood pressure is decreased. Your GI tract, you have increased peristalsis because you got to process that pizza you just ate and that apple, right? And your bladder, again, constricts the bladder muscle. And again, the question is whether it's constricting the outside one or the one that's in the sphincter. Don't worry about that right now. We'll talk about it when we get to specific drugs that affect those. And then salivary gland, you're resting and digesting, so you better have some increased salivation. So I hope you can see that those are almost polar opposites of each other. So let's look at the differences by system. If you look at sympathetic versus parasympathetic, sometimes they're called adrenergic. Sympathetic's called an adrenergic system, and parasympathetic is called a cholinergic system. And if you look at it, and you look at the neurotransmitter, that's where those names come from. Because the neurotransmitter in the sympathetic nervous system is norepinephrine or epinephrine. And in the past, epinephrine's been called adrenaline, right? So you've heard that. Actually, I don't think there's an E on there. So you've actually heard that term, like, oh, I got to get my adrenaline going. I got to get going. Well, so when you hear adrenergic, it comes from that adrenaline neurotransmitter that is in the sympathetic nervous system. Parasympathetic is acetylcholine. And acetylcholine, if you think about it, that's where cholinergic comes from. Sorry, gang, needed a drink of water. Your receptor types in the sympathetic nervous system are alpha and beta receptors. And in the parasympathetic, it's nicotinic and muscarinic receptors. The nicotinic receptors are mostly in skeletal muscle, so we don't see as many drugs with those, but muscarinic is primarily what we'll be looking at. So just a reminder, neurotransmitters are chemical substances produced and released by axons, right? Those are nerve fibers that transmit a signal to a target neuron, cell, or gland. Okay, so the drug types that work in the sympathetic nervous system are drugs that either act like, so they mimic the sympathetic nervous system, or they block the sympathetic nervous system, meaning they are blocking different receptors, okay? So you're going to hear different names, and I'm sorry that we even have to talk about this, but unfortunately, you're going to hear these terms, and I don't know why we've given them so many terms because it makes it a little bit confusing, but sympathomimetic, right? Think of a mime. A mime is someone that acts like someone else. And so sympathomimetic is, again, a drug that acts like the sympathetic nervous system. And again, remember, here's our friend adrenaline. So it could also be called an adrenergic agonist. And specifically, you don't hear too much the term adrenergic agonist. You'll hear more like a beta agonist or an alpha agonist, because those are the receptors in this system. But again, so you may hear adrenergic agonists, you may hear adrenergics, again, like adrenaline, also epinephrine. So, and then things that block the SNS are sympatholytics and adrenergic blockers. But again, you're probably going to hear them more in terms of like beta blockers or alpha blockers. We're going to be more specific about the receptor type. Okay, drugs that work in the parasympathetic nervous system. Again, you have mimickers and blockers, okay? So your mimicker is going to be something called a parasympathomimic, right? So it's mimicking the parasympathetic nervous system. But remember, our neurotransmitter is acetylcholine. So sometimes you'll also see the term cholinergic used. And then in terms of blockers, you'll hear parasympatholytics. Remember, lysis means to break apart or to stop. So you can think of it sort of as a stopper, parasympatholytic, or an anticholinergic. And I have to tell you, anticholinergic is a term that you'll hear a lot as you are working in your various agencies. So we use that term a lot more than parasympatholytic. Thank God. Right? Okay, so again, here's the neurotransmitters. You have the sympathetic nervous system here, and you have the parasympathetic nervous system. And again, what are the neurotransmitters that interact between that? Don't get into the whole postganglionic neuron. That's for, again, another day. It's not something that we need to know, but what are the neurotransmitters that are actually acting right on the receptors that we're talking about? So alpha receptors or beta receptors, or in the case of the parasympathetic nervous system, muscarinic, or like I said, in the skeletal muscle, nicotinic receptors. Okay. So let's go look at our sympathetic nervous system receptors. And again, now we're talking about fight or flight, right? And again, remember the overall term is adrenergic. So you have 4 types of receptors here. Alpha 1, alpha 2, beta 1, beta 2. There's actually beta 3, but I'm not going to have you learn it because you just don't really need it right now. It only affects the uterus, so don't worry about that. So alpha 1 and alpha 2 primarily affects blood vessels, not arteries, blood vessels, okay? And so alpha 1 tends to cause vasoconstriction, and alpha 2 tends to deal with vasodilation, okay? So you can sort of see, that when we vasoconstrict, we have increased blood pressure, increased blood return to the heart, increased circulation. If we have alpha 2 stimulation, we're going to have vasodilation, which decreases vasoconstriction, right? Those vessels get bigger and blood pressure drops and gets a little bit lower. And then you have beta 1 and beta 2. And beta 1 and beta 2, I've already given you this hint, but you have one heart and two lungs. So beta 1s primarily affect the heart, and beta 2s primarily affect the lungs. Now, we also know that beta 2s can affect peripheral blood vessels as well, but we don't really understand the mechanism behind it, which is really interesting. Your book actually says that. And so we know that, for instance, like beta blockers that, are given for like blood pressure, they tend to work mostly on the heart by decreasing the heart rate, which then decreases cardiac output, which then decreases blood pressure. And we'll talk about that a little bit more later. And I know you're learning about blood pressure and some of these other vital signs. And so these drugs have a big effect on vital signs. Beta 1s increase heart rate and they increase force of contraction. And beta 2s deal with bronchodilation and they decrease uterine contractions. So if you think about it, like a beta 2 agonist would be something good to give somebody who's going into preterm labor, because we don't want them to have the baby too soon. Baby can't survive outside the womb. So if we could tell the uterus to sort of, chill out a little bit, then that would be a good drug. So when you get to OB, you will learn about some of those medications. Oh, darn it, guys. I'm so sorry. I just realized that this slide, I copied it from the previous slide just for the formatting, but then I didn't update it with the correct information in it. So please put a big X through this. I will provide you with the correct information, and of course, this will not be on your quiz. So the problem is, now that I'm recording it, I can't like stop and fix it while I'm in the middle of recording. So I will fix it. I will send you an updated correct one, and I may do just like a little teeny tiny mini narrated lecture on the one slide. Okay, so sorry, not trying to mess with you here, but also just going to say that stimulating cholinergic receptors actually is not that great. So we don't use them that much. Anyway, okay. So let's move on. Clinical applications for the parasympathetic nervous system. So this is what I was just saying to you, that due to the high potential for serious effects with the parasympathomimetics, right, cholinergics, they're not widely used in drug therapy. Too much cholinergic medication is given, patients can have what's called a cholinergic crisis, and that's on the next slide. But most often, we are using drugs that block the parasympathetic nervous system. So anticholinergics, and I think I mentioned that before. These we use a lot more in clinical practice. So, for instance, has anybody ever taken like Dramamine? Dramamine is an anticholinergic, and we use it for motion sickness, but it also decreases gastric acid secretion, slows intestinal motility. We use anticholinergic eye drops. That's what your doctor uses when you go in and have an eye exam and they dilate your eyes. Now, hopefully, they're using that super cool machine where you don't have to get your eyes dilated. And yes, there really is that machine. So if you haven't had it done, It is awesome. It's better than being blind all day. Heart, they are used to increase heart rate. And so, again, can be used for, cardiac situations. In the lungs, they can be used to treat asthma and COPD. There are several anticholinergics that tend to get mixed in with beta 2 agonists, because remember, the two of those together, if it's an anticholinergic, it's going to act like a sympathetic nervous system stimulant. And then if we put it in with a sympathetic nervous system stimulant, like a beta 2 agonist, like albuterol, it's kind of a double whammy, but different mechanisms of action. And it's used to treat asthma and COPD. Especially in like the emergency room, or if someone has been admitted to the hospital, they will do these anticholinergic drugs by nebulizer. And then for the bladder, sometimes we use them to treat overactive bladders so that people aren't like having to rush to the bathroom in the middle of things. And overactive bladder, usually there's like not a lot of warning, and like when you have to pee, and there's really not a lot of ability to hold it. So anyway, it works well for that. And then anticholinergics can also be used to treat the tremor from Parkinson's disease. And again, not super well understood why it works, but it's used. And then the other place that it's used, they're used are in anesthesia. So the anesthesiologist uses them to decrease like excessive respiratory secretions and to reverse bradycardia during surgery. So if somebody's heart rate starts to slow down a little bit, we can give an anticholinergic. Okay, cholinergic crisis. This is what happens if we have too much cholinergic stimulation. So again, if you look at all of these symptoms, and you'll notice that one spells sludge, and the nicotinic symptoms are Monday, Tuesday, Wednesday, Thursday, Friday, like the days of the week. Remember, I told you that nicotinic is almost all skeletal muscle. We'll check it out. These are almost all skeletal muscle things. And then over here, muscarinic is all things that we talked about as well, that anticholinergics, right, kind of deal with. So if you have a cholinergic crisis, the only drug that treats that is atropine. And when we get to our prototypes for the autonomic nervous system, we will learn atropine. So atropine would be sort of considered the antidote to someone who's in a cholinergic crisis. Luckily, we don't see this too often, which is good. So when we look at clinical applications for the sympathetic nervous system mimickers, I should say mimickers, it really depends on the receptor that's affected. So remember, we talked about alpha 1s. So if we stimulate alpha 1s, an alpha 1 agonist, we can actually cause a little bit of vasoconstriction in the nose, and that's really good for treating nasal congestion. Can also be used for dilating eyes, right? And then alpha 2 is treatment of hypertension. Now remember that for the most part, the alphas are about blood vessels, okay? So alpha 2 is the treatment of hypertension through a centrally acting mechanism. It's kind of weird. Like, we don't really know exactly how alpha 2s work. We know that they work somehow in hopefully stopping the RAS system from revving up your, how much water you retain, which then increases your blood pressure, which then causes pressure on your heart, blah, 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 blah. Anyway, we'll talk more about that. But anyway, we can use alpha 2s for hypertension. And we actually have a prototype that works that way. And then beta 1s are often used for treatment of cardiac arrest. Remember, beta 1 is for your heart. And stimulation of beta 1 is increased heart rate, increased force of contraction, increased blood pressure. So This is a great drug to use like in a cardiac arrest or somebody who has heart failure or shock. And then beta 2s are great for treatment of bronchoconstriction and asthma. If you think about beta 2s, your albuterol inhaler that you see your friend use or you use, they pull it out of their backpack, puff, puff. That is a beta 2 agonist, and it causes immediate bronchodilation, which makes you feel so much better. So it's treatment of bronchoconstriction, which is like an asthma attack, and this med will help reverse that. And then the side effects, of these mimickers on both the peripheral nervous system and the sympathetic nervous system, it's just too much of whatever the effect normally is, right? So I think that's a really good thing to remember, and we're going to be talking about that a lot this semester. Okay, so clinical applications for sympathetic nervous system blockers. Now, these drugs have a huge, wide therapeutic application in the treatment of hypertension. So when you hear about beta blockers or alpha blockers, you're usually talking about hypertension treatment, okay? So alpha blockers relax vascular smooth muscle. Beta blockers, again, work on the cardiovascular system. They treat hypertension, and again, this is reduced by decreasing heart rate and reduction of renin in the kidneys, which blocks the RAS system. Side effects from these alpha blockers and beta blockers is, again, mostly due to too much blocking, so due to beta blockade. So, for instance, if beta 1s really help your heart pump better, you can actually, and you're doing a beta blocker, you could actually make heart failure worse in someone. Or maybe somebody takes a beta blocker for their hypertension and they didn't know they were having a little bit of heart failure, and all of a sudden they start going into heart failure once they're on the beta blocker. Beta blockers can make asthma and COPD worse, which is kind of interesting. Now, I take a beta blocker and I also have asthma, but my beta blocker does not bother my asthma, at least not noticeably for me, but it is something that you need to be aware of because, again, remember, beta 2s, 2 lungs. If you stimulate that, you're going to get bronchodilation. So if you're taking a beta blocker, all of a sudden now you have, beta blockade, you may have some issues with your asthma or COPD. And then a really important thing to note about beta blockers in general is they can cause hypoglycemia or hyperglycemia, and they frequently mask the symptoms of hypoglycemia in patients with diabetes. Well, think about your patients with diabetes. What are they suffering from? Well, they tend to have heart issues, cardiovascular issues from high levels of sugar. And so a lot of them have hypertension. And so if you're going to also give them beta blockers, you've got to be aware that if they have diabetes, this could be a problem in terms of masking symptoms of hypoglycemia, because hypoglycemia and hyperglycemia can be fatal. All right, guys, that ends our overview of the autonomic nervous system, which consists of the parasympathetic and the sympathetic. I hope this is helpful, and I will talk to you soon.